Good evening, folks, and welcome to the last of a four-part series. Tonight's presentation is ADHD, anxiety, and the autism spectrum. This series is brought to you in partnership between the Auburn Schools of Virginia and Maryland and Potomac Psychiatry. I'm Andy Hubner, the Executive Director of the Auburn Schools. The Auburn Schools are small, intimate, independent day schools specializing in providing supports to students in areas of executive functioning, social learning, and pragmatics and self-regulation. Although we are not diagnosis-driven, we do serve students with high-functioning autism, social pragmatic disorder, sensory processing disorder, communication challenges, ADHD, anxiety, depression, and executive dysfunction. We have two campuses, one in Chantilly, Virginia, and one in Silver Spring, Maryland. Please visit our website for additional information, including open houses and admissions at www.theauburnschool.org. It is now my great pleasure to introduce to you Dominic Fabrizio, Director of Client Services for Potomac Psychiatry.
Hello, everyone. Thank you, Andy, for the opportunity to present this series along with the Auburn School. Good evening, everyone, and welcome. My name is Dominic Fabrizio. I'm the Director of Patient Experience at Potomac Psychiatry. Thank you for joining us. At Potomac Psychiatry, we don't just treat our patients' symptoms, we uncover and treat the underlying root causes of their mental health conditions using recent advances in genetic testing, gut microbiome assessment, cellular health, and immune system functioning, and other cutting-edge laboratory tests. We practice root cause psychiatry. This is the final session of our four-part webinar series where top experts in autism will be available to answer your questions. Potomac Psychiatry has pre-recorded 6 highly informative video webinars from these experts. And at the end of the session, I will let you know how you can view these webinars online and be able to attend any of our upcoming events after this series. And now it is my honor to introduce Dr. Margery Johnson. Dr. Margery Johnson is a gifted adolescent and young adult psychiatrist who enjoys helping young people get on track with developmentally and is passionate about working with them and their parents to help these children achieve what they are capable of as adults. Dr. Johnson is board certified in adult and in child and adolescent psychiatry, and based on extensive clinical experience, takes a flexible approach using a variety of treatment modalities. And without any further introduction, it's awesome to have you here, Dr. Margery Johnson.
I'm very pleased to be here this evening. And the two topics I'm going to be trying to address are particularly of interest to me. I do see quite a few children, adolescents, and young adults on the autism spectrum. And I'm finding that more and more frequently, I am evaluating and treating coexisting ADHD and anxiety in these individuals. And I think this reflects an increased appreciation in the last few years of coexisting conditions in particularly the higher functioning individuals on the autism spectrum. So that while the core neurodevelopmental issues of autism are not necessarily amenable to medication treatment at this point, but that anxiety and ADHD can be having a significant impact on the lives and functioning of these children and young adults, so that treating those coexisting conditions can have a hugely positive impact on quality of life, functioning, and ultimate outcome. The medications that are used to treat ADHD and anxiety are sometimes a little more challenging to use with the neurodiverse population, so that it can be a little tricky. One of the things that is particularly interesting to me is that until the last revision of the Diagnostic and Statistical Manual of Psychiatry, you could not diagnose a child or an adult, for that matter, with both autism and ADHD. which just completely went against observation of, professionals and parents. And so that the change in the diagnostic manual, I think, really sort of reflects an increasing appreciation of some of the challenges and limitations of the higher functioning individuals on the autism spectrum. So those are some of my introductory thoughts, and I welcome your questions.
Well, thank you so much, Dr. Johnson. Just so everybody here knows, and for anyone that's coming in right now, maybe running a little bit late, what you can do, and we hope you all do it, at the bottom of your screen, there should be a little thing that says Q&A. Go ahead and click on that, and you'll be able to ask any questions to Dr. Johnson. And another thing, real quick, I'm going to pop open a poll here, and it's just a simple little question. Feel free to answer it as you see fit, and we'll let that run until we get everyone's response. And I see a couple questions coming in right now, Dr. Johnson, so we're going to start it off right now. So first of all, how do the symptoms of anxiety and ADHD manifest differently in children with autism compared to those without autism? Good question.
Yeah, that's a difficult question. There certainly are, well, let me take them separately. In terms of ADHD, in a lot of ways, that may be more straightforward in that you can use some of the same rating scales and some of the same symptoms are present in individuals on the autism spectrum. There are perhaps some symptoms that are more common or more problematic in the autistic individuals, particularly the physical restlessness and physical impulsivity that can really have an impact on the child's ability to be safe, to not run off, or to be able to benefit from some of the developmental therapies like speech and language or OTPT that are so important for individuals on the autism spectrum. In the children who have who are perhaps lower functioning and may have significant verbal delays, it can be difficult to assess attention because the child may appear to be paying attention, but could be, off in his or her own world. But the standardized rating scales, Vanderbilt teacher scales, Vanderbilt parent scales, are still valid in individuals on the autism spectrum. Anxiety in the individual on the autism spectrum is often more apparent through avoidant behavior as opposed to expressing particular worries or fears. That avoidance of new things and oppositional behaviors may be more often the manifestations of anxiety in an individual on the autism spectrum. So a lot of times you have to kind of infer the anxious thoughts from the child's behavior. So it can be challenging.
Well, thank you for that question. Let's see here. Thank you for that question. Thank you for that answer, Dr. Johnson. Let's see here. Okay. All right. Are there specific behavioral therapies you recommend for children with autism who also suffer from anxiety and ADHD?
Well, certainly the behavioral therapies that are most often used for children on the autism spectrum can be, in a sense, modified or directed specifically toward symptoms of anxiety, particularly avoidance, difficulty with transitioning from one activity to another, which is also an issue in ADHD. So that the sort of standard, ABA therapies can be modified and oriented toward those specific problems. But in general, the treatment approach for anxiety is to face your fears, to confront the things that make you anxious so that you can learn to overcome them. And that basic principle certainly applies to persons on the autism spectrum, perhaps with some modification in the sense of maybe taking smaller steps and just being, a little more sensitive or a little more patient, but that the basic concept applies. Particularly, I think about the adolescents or young adults on the autism spectrum who have a lot of social anxiety. That they're very vulnerable to becoming socially withdrawn, which obviously has major implications, both obviously socially but also vocationally, so that anxiety about social contact really needs to be addressed so that the child can do what they're capable of doing. Certainly, sensory integration problems can further complicate treatment of social anxiety if there's a contribution of sensitivity to sound or to touch, can make social situations even more challenging. But again, it needs to be gradually confronted and overcome.
All right. Well, another great question, another great answer. Just so everyone knows, anyone that's joined late, I see a couple people that have jumped on a little bit later. No worries. At the bottom of your screen, click the Q&A to ask any questions that you'd like, and we're getting through them right now. And so, real quick, we got another one that just came in. Here we go. Could you elaborate on how parents and educators can distinguish between typical autistic behaviors and signs of anxiety or ADHD?
Well, yeah, because it's not easy. There's a lot of overlap, which is part of why addressing ADHD and anxiety in autistic individuals has been neglected for a long time, because people were just struggling to feel comfortable diagnosing autism. I've seen huge changes in the course of my career, which is helpful. Experience does help. Particularly, physical restlessness, stereotyped movements can look like ADHD or overlap with ADHD. I think a big issue with anxiety is it's very difficult at times to distinguish obsessive compulsive behaviors or even tics from stereotyped movements or ritualistic behaviors that are seen in autism. Unfortunately, the obsessive thinking in autism does not respond to medication treatment as robustly as obsessive thoughts do in typical OCD. That was a big disappointment when the SSRIs first came on the market. I think a lot of us thought, wow, this is going to be great for the problematic obsessive thinking in autistic individuals. And it was really disappointing that it didn't turn out quite as well as I had hoped. But it's still, it's still worth looking at.
Well, perfect. So we have another question that just came in, Dr. Johnson. It's interesting. I think Dr. Chuck Ng could help answer this question a little bit, but I still am going to ask it here. How long does it take to diagnose someone with autism, and does the diagnostician need to see the person? And how long, and does the diagnostician need to see the person?
Well, first of all, I think the diagnostician needs to see the patient.
Okay.
I'm not comfortable diagnosing anyone that I haven't seen. Although, frankly, with some of the lower functioning autistic patients, 30 seconds will do it. And sort of the more high functioning someone is, and the more subtle the symptoms are, it's much more challenging. A severely impaired, classically autistic child is not difficult to diagnose. What I struggle with is the very high end of the spectrum, because there is some gray area, and I do see a fair number of particularly adolescents and young adults who have significant autistic features, and might have autistic symptoms clustering in one particular area, but don't have some of the more objective symptoms or behaviors that are seen in the more severely impaired individuals. So it can be difficult. With some people, it does not require a whole lot of evaluation. For some, use of standardized rating scales can help either confirm or challenge your clinical impression. Sometimes where there are clear specific learning problems, the full-scale neuropsychological testing is helpful. So I guess the answer is it really varies a lot. And you can sort of do a quick screening, but if things are much more complicated and there are significant strengths and weaknesses, more extensive testing is often necessary.
Well, thank you, Dr. Johnson. I'm not in the business of picking my favorite questions, but I just had a really good question come in, and I'm interested to hear your response here. Do you always encourage sharing the diagnosis of ASD in individuals who are very high functioning if there is a concern about the diagnosis and how it will impact their sense of self?
That is a good question.
That is a good question.
It in part, I suppose, depends on the age of the individual. I think with younger kids, you might not necessarily give them a diagnosis, but maybe discuss ways in which they are different than other kids, and emphasizing that obviously everybody's different, but helping them start to look at what their strengths and weaknesses are and come to grips with, I'm always telling people your obligation or the goal is to deal with your difficulties and your vulnerabilities, but also just as important is to make the most of your strong points. So I think with younger kids, it's helping them understand their strengths and their weaknesses and ways in which they might be different than other kids. With older adolescents and young adults, I see a lot of individuals who feel a certain degree of relief, even when they have an evaluation and it becomes clear that they are on the autism spectrum, because sometimes they have just struggled with feeling like there's something wrong with me. I don't seem to react the same as other people. I do things differently. And for some, it's like just sort of a self-acceptance and realizing that, yeah, I'm different in some ways, and that's the way it is, but I've got all these other strengths, and that self-understanding can be helpful in and of itself. Again, that's mostly with the high school, college age, young adult age individuals.
So you would say age kind of helps you decide where to go here, but also it's a case by case situation.
Yeah, yeah. Obviously, the degree of self-awareness and overall cognitive ability influences how you approach it with the child.
Very good questions coming in, everybody. Very good questions. Keep them coming. Keep them coming. We have another one for you, Dr. Johnson. They're gonna take up all of your time. And so here we go. How do you approach medication management for a child with autism who also needs treatment for anxiety and ADHD?
Well, there's a very large degree of what's called comorbidity, coexistence of ADHD and anxiety in the population in general. So this is something that comes up with individuals on and off the autism spectrum. And a lot of times I see somebody and I say, okay, clearly there's anxiety and there's ADHD, and each affects the other. What I mean is, anxiety, I think we all know that, anxiety affects your ability to pay attention. And inattention can make you anxious. Like when you realize you have no idea what has been going on in the conversation or in the classroom, can make you pretty anxious. And so it's often difficult to tease apart how much is anxiety and how much is ADHD. So I usually ask the family and the patient, which they want to approach first, because you want to do one and see what you can get from treating that condition. Very often people opt to focus on the ADHD first, because the medications take effect more quickly. So that sometimes a medication regimen can be settled upon fairly quickly with ADHD compared with anxiety, which is more like a several months process. So a lot of people opt to focus on ADHD first. Some feel that clearly the anxiety is having a bigger impact and want to focus on that first. So I tend to leave it up to the patient and the family to decide which is their priority, because either is completely legitimate approach.
Would you say treating anxiety or ADHD and you find it a lot, that it has a huge impact on the other? And so it has a treating ADHD has a huge impact on the need even to treat anxiety.
Yeah, it certainly has. It has happened, particularly. I think of like adolescents with social anxiety. If they're generally more with it and can follow a conversation better, their social anxiety often gets a lot better. So sometimes you treat one and then decide that the other is either getting better or could be dealt with in therapy, in psychotherapy.
Interesting. Interesting, the connection between the two.
Yeah, it is.
You got
I think
more
it's just,
questions?
I think there's just generally in child and adolescent psychiatry been an increasing appreciation of the complexity of comorbid disorders, that of more than one problem and how they all interact. Yeah, I think it's just kind of gotten a more sophisticated understanding of things.
Well, that's good. That's good to hear that it's starting to go that direction. Something else that just came in. Here we go. Thank you for these questions, by the way, everybody. And anything that we don't get to, we promise that we'll have answers for you through email in the upcoming weeks. Here we are. Can you share any recent innovative therapies that are showing promise treating anxiety and ADHD in the context of autism? So what's new? What's going on?
Okay. Yeah, there are some new treatments available for ADHD that have not been tested. I'm not aware of any studies including individuals on the autism spectrum. With most new treatments, researchers will start with a carefully selected narrow population of the sort of the core audience, so to speak, for that treatment. And then only later do they include more complex cases. One very new treatment, which actually our developmental and behavioral pediatrician, Dr. Ng, is much more knowledgeable about this than I am, is there's been some really new, really cutting edge research on the folate receptor antibodies that seem to be present in a fair percentage of individuals with autism. And there is folate receptor antibody testing, FRAT testing, that is being done. And if the individual has antibodies to the folate receptor, it can be treated with a very high dose form of folic acid. And the research is showing significant improvements in particularly young children with autism. It's not clear how effective it is with older individuals, but preliminary research is showing good outcomes in terms of improved social relatedness and communication in young children with autism. So since I treat mostly older children and adolescents with autism, I'm really looking forward to seeing some research on older individuals.
We have it. Oh, go ahead. Sorry.
No, there haven't been any major, like, new groups of medications for anxiety or ADHD. When I started in child psychiatry, I think there were like 3 stimulants on the market. Now there are so many that I have to have a chart to keep straight all the dose strengths and whether they can be taken apart and sprinkled or whether you have to swallow it whole. It's a dizzying array of medications for ADHD. But it's great that there are so many options, because it does allow you to, fine tune the treatment. And, somebody might not do well on 1, 2, 3, even 4 different stimulants. So it's nice, but they might do great on the 5th one that you try. or at least well enough that it's worth sticking with. So I really like having so many options. There are now some longer acting stimulants that are very useful for the high school, college, and adult patients. So there are more options for really long day, entire day treatment. Yeah, so different preparations. It's nice to have lots of options.
Well, that's good news to hear. So we do have our final two questions that have come in. And so we have two more questions. If anyone else would like to ask any questions in that Q&A button, go ahead and do it now. And we'll be sure to get a response to you in the coming weeks from Dr. Johnson. So in here, is there any treatment in terms of functional medicine, diet, lifestyle, etc., for ADHD?
There are a few things, none of which have as large an effect size as stimulants, but certainly as additional treatments. There's some evidence that omega fatty acids, fish oil capsules are helpful. Magnesium is often helpful for sleep. Obviously, a well-balanced, good diet is good for everybody. Let's see, what else? Those are the ones that have. Those are the only ones that have a really solid research base for recommending. Yeah. There's a very interesting new non-medication treatment for ADHD that has not been tested in autistic individuals. It's an external trigeminal nerve stimulator. It's a thing that you have to strap it to the child's head and they sleep with it, which strikes me as challenging for anybody who has sensory difficulties or any difficulty with sleep. But that has been shown to reduce symptoms of ADHD without medication. I'd certainly love to see more non-medication or non-prescription treatments for ADHD for anyone with ADHD.
Okay, perfect. I like that. All right. Just managing all the questions that are coming in. Sorry about that, Dr. Johnson. But we have our last question right here. I like this question too. How do you help a child with autism and anxiety with school refusal?
Well, school refusal is really tough. And the older the child, the more difficult it is. You can't put a 15-year-old under your arm and march them into school. But basically, with school refusal, child has to return to school. And the longer the child is out of school, the more difficult it is to get back. But it's just a matter of small steps, slow steps, and the incremental steps may need to be, kind of ridiculously small. But if you did better today than yesterday, that's wonderful. So ideally, you return the child to school, preferably to do something that, it could just be setting foot in the entryway to the school. But, if in terms of actually getting the child back into a classroom, you figure out what they enjoy the most. Do they like meeting with a counselor? Okay, if they do, then that's the first step. If they like art class, then they get to go to art class first. Some people actually like gym. Most of us hated it. But if they like gym, you let them go to gym. And then when they're comfortable with that, you take the next step. But it requires a lot of persistence and requires, close communication between the school and the parents, because you've got to be, working together as a team. So flexibility on the part of the school is really important, as you probably all know.
Well, I'm sure Andy could help you with that.
Yes.
Very, very interesting. Well, thank you everyone for all of your questions. Any of the ones that we didn't get to, we'll get back to you via email. And thank you, Dr. Johnson, for your comprehensive and thoughtful replies. I'm sure we have learned a lot this evening. And for those of you in attendance who may have arrived late, this evening's presentation is being recorded. And tomorrow you'll receive an email announcement regarding our conclusion of this series. And inside of it, you'll receive a link to this video. Also, you'll receive a link to all of the other recorded videos that are on our website. We have 2 other live Q&As that have been recorded that are on our website, as well as 6 pre-recorded presentations from our experts. With that being said, if you have any questions at all, feel free to go to PotomacPsychiatry.com and learn more. And also you can snoop around and see a little bit about Dr. Johnson on our own website. And thank you again for coming. And I hope everyone has a wonderful evening. And feel free to reach out to me. Everyone here has my email.